Hi there, I am Crystal Jeanville, healthcare provider, and today I'm going to discuss with you disease prevention through immunizations. Athletes are at increased risk for numerous infections. Olympic athletes, however, who travel and live in close contact environments are at even a higher risk. Infections and their effects, such as fatigue and fever, can adversely affect performance by weakening muscles, decreasing blood flow to the body, and predisposing those affected to other injuries. Therefore, education on disease prevention through immunization is critical to keeping young athletes safe and healthy. Infections can be spread through respiratory secretions, blood, or via skin contact. Some infections can be avoided or prevented by receiving immunizations. Immunizations are an example of primary prevention, which aims to prevent the development of the disease before infection even occurs. Athletes should be immunized for the following: yellow fever, hepatitis B, influenza, tetanus. Yellow fever. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes. Symptoms: fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. Vaccination is the most important means of preventing yellow fever. Hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. The virus is transmitted through contact with the blood or other body fluids of an infected person. Symptoms: most people do not experience any symptoms during the acute infection phase. However, some people have acute illness with symptoms that last several weeks, including jaundice, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. It can be prevented by currently available safe and effective vaccine. Tetanus. Tetanus is a serious disease caused by a bacterial toxin that affects your nervous system, leading to painful muscle contractions, particularly of your jaw and neck muscles. Tetanus can interfere with your ability to breathe and can threaten your life. Tetanus is commonly known as lockjaw. Symptoms: spasms and stiffness in your jaw muscles, stiffness of your neck muscles, difficulty swallowing, stiffness of your abdominal muscles, painful body spasms lasting for several minutes, typically triggered by minor occurrences such as a draft, loud noise, physical touch, or even light. It can be prevented by currently available safe and effective vaccine. Influenza. The influenza virus can be transmitted by respiratory droplets, contagious 1 day before symptoms start until 5 to 7 days after becoming sick. Symptoms: fever, chills, muscle or body aches, headache, coughing, runny nose, and sore throat. Rare but serious complications include bacterial pneumonia and even death. Symptoms usually last 1 week but can be greater than 2 weeks. Symptoms make it difficult for the athlete to continue training and competing. Receive yearly flu vaccine at start of flu season. Protection is not 100%, but disease is usually milder in those vaccinated. Vaccines work best in older children and healthy adults. So, there we have it for immunization. Talk to you soon on sports hygiene. Do have a safe and wonderful rugby season. Don't forget to get immunized. Bye.